Okay, we're good. All right. So hi, everyone. Welcome to HS Connect's first psychodermatology series, where we dive deeper and deeper into the mind-body connection. Before we get started, I just want to give a few reminders that this interview does not replace any counseling, therapy, or psychological services, and nothing in this interview or any information contained within it substitute for professional care by a doctor or a qualified medical professional. If you need help or you need to talk to someone, please visit our website at hsconnect.org for more resources, and there will be resources posted with this interview as well. So our first guest is Dr. Mina Guirguis. He's a clinical psychologist, a psychodermatologist, and a member of the American Association of Cutaneous Medicine. He received his Doctor of Psychology degree in clinical psychology with an emphasis in behavioral medicine from California School of Professional Psychology in 2005, and he's been practicing since. He's currently the director of the Emotional Wellness Center for Skin Disorders, which is located in Southern California, and he's offering to talk to us today and share a bit about his knowledge, and all of his information will be linked down with this interview as well. So if you want to learn more about him, you can go ahead and click on all that. So thank you for joining us today.
Of course.
And
thank you for inviting me.
Yes, and this is just a huge passion project for HS Connect, because one of the things that we really, as HS sufferers, have dealt with a lot is that there's a cycle pattern of which we have a skin flare, and we get kind of sad about it, we get anxious about it, and then the flare gets worse. Or we have stress from other parts of our life, and we get a little nervous, we get a little depressed, and then we have a flare, or the condition progresses poorly. And we really wanted people to know that this is a whole field that people have devoted their lives to and study, and there's people out there that specifically look at and want to help patients who suffer in this way. So with that, can you give us a little bit of a general overview of what is psychodermatology and what is it hoping to accomplish?
Sure. So psychodermatology in comparison to dermatology itself and clinical psychology or psychiatry is something new. It's a new field. Mm-hmm. And it came about from dermatologists and psychiatrists kind of looking at how a person deals with skin disorders, whatever it is, and how it affects their emotional well-being, and vice versa, how emotional well-being and stress affects how someone's skin reacts to the stress. Mm-hmm. And I can talk from experience in terms of vitiligo. Vitiligo is an autoimmune disorder. Mm-hmm. And there was a lot of going back and forth pretty much about what causes vitiligo. Is it stress? Is it just genetics? No one really knows. But what we do know is when someone is experiencing emotional and psychological stress, their vitiligo gets worse. That means they get new patches of skin that doesn't have any pigment. So there is definitely a correlation between how someone reacts to stress, environmental stress, emotional stress, and how the mind-body connection, plays out in that the person can, their skin condition can get worsened, get flared up, and so forth. So again, psychodermatology, it kind of studies that and looks at the connection between skin disorders and the emotional, psychological well-being of a person.
Yes, and that is really unique to skin, because a lot of times you hear no one really has a skin identity, you have an identity with your skin, there's a cultural aspect to it, but no one really says that about their kidney or their liver. So there's definitely a lot that intersects with how we maintain and think about our skin health. And with that, and you touched a little bit on your experience with vitiligo, that seems like, how did that kind of merger happen between your personal journey with this condition and also training to be a psychologist? Did that really help you come to acceptance of the condition?
Sure. So I was in my 20s when I started noticing white patches on my skin, and I was really kind of didn't really understand what was going on. I was maybe even in denial, like this is going to go away. I really didn't understand.
Mm-hmm.
And then it didn't go away. I was like, okay, well, what is causing this? What could that be related to? And again, I really didn't have a lot of answers. And when I went to dermatologists, a lot of times they said, well, it's a condition that people get. We really don't know what causes it, but here is some tropopine, like some medication that you can put on it. We
Yeah.
cannot guarantee success,
Mm-hmm.
but this is the best treatment that we have right now.
Yeah.
And of course, having all of these unknowns created in my mind a lot of questions about, how am I going to handle it? Of course, I got anxious. I got depressed.
Mm-hmm.
Thinking about my future. Who's going to accept me? How am I going to
Yeah.
partner?
Yes.
When I have a condition like that. So what I did is I tried to hide it. I kind of started hiding it because out of sight, out of mind.
Mm-hmm.
Kind of like if no one sees it and I don't see it, maybe it's kind of just go away. Of course, that doesn't happen.
Right, right.
And I hid it for a long time, and then I went into psychology. It's like going into the field of psychology and deciding to be a psychologist really doesn't have anything to do with me having vitiligo.
Oh, okay.
However, it did help me later on, and also did help me starting the Emotional Wellness Center for Skin Disorders. So once I decided that I'm no longer willing to hide my condition, I'm no longer willing to be enslaved, if you will, to my own psychological pressure that I was putting on myself by hiding it. Right? Once I had the acceptance, and we'll talk about the stages of loss. With the last stage, when someone loses their identity or they lose how they were prior to vitiligo, prior to a skin condition, to after a skin condition, there is a loss of the identity of who you are. So once I decided that I'm no longer going to hide this, I was free, emotionally, psychologically, I was free. And that was a great feeling, that I don't have to hide it. And this is who I am. And if people accept me for who I am, that's great. If people don't accept me for who I am, that's on them. I'm not going to take that and put it on my back and carry it around.
Yes.
So,
and that has a lot of, similarities with HS, because, the lesions can happen, or the abscesses or nodules all over the body, but most commonly it's in areas that we can hide with clothing. And so there's a certain element where, you can keep it from people, but eventually, it kind of shows in your behavior and the way you're treating or situations you're avoiding, like socially or romantically. And with that too, how would you recommend kind of going about dealing with maybe family members who don't understand or are difficult to communicate with, or even, telling someone in a romantic relationship early on that, this is a condition that I have, kind of in a way that's sustainable and healthy for people?
Okay. So definitely, I mean, that's definitely an anxiety-provoking thought, because all of this, like, what if?
Yes.
What if thoughts always produces anxiety, right? Because you're trying to ask questions about a future situation you don't have the answers to.
Yes.
Right? So you're trying to kind of like fill in the blank.
Yeah.
Right?
Yeah.
So in terms of talking to a partner, you have to be honest, because if you do hide it, and the time will come where you're not going to be able to hide it, I mean, right? the
Yes.
person is going to say, well, why weren't you honest with me? How come you hid this from me? And maybe they're going to say, well, if I knew that, I don't want to be with you, right? So that's going to create a lot of issues in the relationship.
Yeah.
However, if you are clear with them from the beginning and you say, this is who I am and I have this, you either accept me with it or you don't accept me with it. If you don't accept me with it, then, hey, you know what? We'll go our separate ways. If you do accept me with it, then, hey, you are an accepting person regardless, right? So being honest is definitely going to help your own emotional well-being and reduces the stress and will put the person on the other end of that relationship also at ease, because they already know there is nothing hidden there. You're not going to surprise them later on and say, huh, voila, here, you know, here it is. You know, so it's like, okay, I think that's extremely important. And also, you know, your ability to do so will really have to do with your own acceptance. Do you accept what you have? Are you really struggling with it? Because if you don't accept it and you're still in denial with it, how are you going to share that information with someone else? Right?
Yeah.
So you have to come and kind of like do your own, go on your own journey of dealing with this and maybe even talking. Go ahead.
Would you say that those are some signs, though, you know, like if you find that you aren't engaging in romantic relationships that you want to have, or not being as social with friends, you know, are those things to look out for, that, hey, maybe, you know, I should think about therapy, or I should think about talking to someone? You know, what are some things to kind of notice as when we should reach out and really come to terms with, you know, where we're at with the condition and how we're thinking about it?
Sure. I think, you know, there is a saying in psychology and mental health that we know ourselves better than anyone else. Even we know ourselves better than our therapist. But so a lot of times we don't take the steps, the follow-up step of what do we do with it. So I know that there is an issue with me. A drug addict knows that there is an issue with them. But do they take the next step? That step will put someone in a position to receive the help that they need. And there's always, sometimes we always have these thoughts that kind of say, okay, I'll do it later. I'll take care of it later. And then later never comes, because every time you have that thought, you say to yourself, oh, I'll deal with it later. But later is what, 5 years, 10 years? And you're continuing to deal with all of that. I would say, no, if there is an issue and you're not happy and you're depressed, you're anxious, and you're limiting your interactions with others, or maybe you're not dating because you're afraid that if you date and you become intimate with someone that they're going to see what you have, this is the time where you have to consider available help. There is available help there. And you might not, in your area, you might not find maybe a therapist who specializes in skin disorders, but therapists and psychologists and clinical social workers and marriage and family therapists and all of that are by profession educated on how to help someone deal with whatever issue it is, right? So, you know, I want to make sure that the audience understand that they might not have a psychodermatologist in their area, but if they choose to work with a professional is going to be able to help them with whatever issue they're struggling with. Now, just the psychodermatologists, they just have, and psychologists who do have an idea of the skin disorders, they have done a little bit more research, they have done a little bit more study about understanding the connection between, you know, the skin disorder and how it really affects their emotional and psychological well-being. But again, I don't want that to just stop anyone from seeking care if they don't find that. So yeah, feeling sad. You know, if you're in a situation you're just feeling sad, you're not able to enjoy the environment. You know, like let's say you're with family and friends and you're just kind of sitting there and you're not enjoying the gathering. You're feeling down, you're crying a lot, you have a lot of negative thinking. You're not able to sleep at night. You're maybe engaging in emotional eating or not eating enough, right? Um, Even having thoughts of suicide. I don't want to live anymore. All of these are indications that please seek psychological help as soon as you can. Um, because you're giving up hope. You don't have any hope anymore, right? So so that means that the person is, all of these means that the person is depressed, right? So,
Yeah.
and if a person is anxious, the person is not really kind of able to find comfort.
Yeah.
They're always kind of like thinking, their mind is racing, or they have a lot of thoughts in their mind, and it's making them really kind of anxious. And anxiety and depression go back in hand, because someone can be anxious to the point that they become depressed, and someone who's depressed, they can become anxious because they're not able to get out of the depression.
Right.
Right?
Yeah.
So the anxiety is kind of like not able to find comfort. They're always on edge. They might be irritated, easily irritated, irritable.
Yeah.
Right? So all of that is a sign also of finding psychological help. Now I wanna mention something here.
Sure.
And I don't know if you're gonna ask me later or not.
Okay.
But there's a really very important website that I always inform and educate you know, patients about, and even people that I you know, kind of talk about mental health. It's called Psychology Today.
Okay.
It's www.psychologytoday.com. And in Psychology Today, there's a place called Therapist Directory. Pretty much you put in your zip code, you put in your insurance information, and it will give you all the therapists in your area on your zip code. Of course, now that it's, you know, online, but it narrows it down to what you're looking for. It's a great resource, and it's something that I really kind of wanted to mention it for your viewers.
Thank you. Yeah.
And I have no like financial relationship with this, so I'm just
psychology.
yeah.
No, thank you. I didn't know that actually they had that search tool, so that's really good, and we'll link that as well. And just your you know, I think it's really important to kind of because, you know, sometimes these signs can be really subtle. You know, people will have, you know, want to engage in a particular relationship, or even, you know, tell a friend of theirs they have HS, and they just keep thinking and thinking. And then these thoughts, you know, it just is constantly there to the point where it becomes bothersome, you know, and it's a decision they're afraid to make, and they think about it all the time, you know. And I think that that link is really important as well, you know, when that constant anxiety will turn into depression or vice versa. And just realizing that, you know, it's hard to notice at times, but, you know, there's definitely signs there. And I think that that explanation was really helpful, because, you know, in the support groups, we try to do that, but there's only a certain point where, you know, that one-on-one therapeutic relationship is really useful. And I think for a lot of people who've speak on our forums, I think there's a little bit of a, maybe, I don't know, media helps with this idea that once you go to a therapist, like that one session, they give you all these epiphanies and, you know, all these like doors open. But can you like give a little bit of an example of, you know, what to look for to or, I mean, you know, is it a gut feeling? Are there things you should look for when you engage with a therapist that, you know, maybe this is a good connection, or maybe I should try someone else, or it's not working? Because I think a lot of people are just waiting for these, you know, truth bombs to say, to kind of drop out of the therapist. So I think if you could speak a little bit to that, and kind of, you know, how to be patient about the process.
Sure. So therapists, they come in different variety, I guess, you know, like there are some good therapists out there, and there is terrible therapists out there, right? And you got to do your research, and you gotta kind of even meet with a therapist, and how do you feel about the therapist? Are you feeling comfortable with this therapist? Do you feel that this therapist is competent in what they're doing? Is this therapist able to actually attentively listen to what you're saying, or are they just kind of head shaking and, you know? So, right? So when you're sitting with a therapist, there's a lot of therapists who will go like this, but really they're not really paying attention to what you're actually saying. So all of this, you know, as you go to a dentist, there's, you know, you got a dentist, and some dentists are great, and some dentists you're like, I will never go back to that dentist again, right? You know, physicians, you go to a physician, you're like, hey, you know what? I really like this physician. They're understanding, they know what they're talking about. And then you go to another physician, and you're like, that guy didn't know, or this, you know, this doctor didn't know what they're talking about, right? So just please expect that within therapy and mental health professionals. Now, a mental health professional should be able to, as I said, listen to really what the patient is saying and help the patient with, assist the patient with finding ways to deal with the situation at hand. We don't have, you know, mental health professionals, especially counselors and therapists, we don't have a pill. We don't have, here, take this medication and will make you feel better. No, that's psychiatrists, they do that. But mental health professionals, especially, as I said, you know, psychologists and counselors, they work with the patient on examining the thoughts or beliefs that the patient might have that actually stops their ability to feel better. I'll give you an example. So when I work with patients and if someone is depressed about a skin condition or depressed about maybe even losing their job or whatever, right? I have to understand what are the thoughts, the beliefs that comes to a person's mind that affects or directly correlates with the way the person is feeling. So if the person is feeling down and depressed, why is that? What thoughts are coming to the person's mind? What beliefs that the person the person actually carries in their mind that affects their ability to feel happy and feel kind of satisfied? A lot of times in depression, the person will tend to use what we call cognitive errors in thinking. Cognitive errors in thinking, for example, like we make a lot of assumptions, or what we say mind reading, or we think in black and white situation, or we catastrophize the situations. All of these are things that we as human beings tend to do. Even therapists, sometimes we tend to do it. For example, no one will like me because of this condition, right? No one will accept me because of this condition. Well, if someone is thinking that way, we can make a pretty good prediction that this person is going to feel sad and not happy, right? It's not rocket science, right? It's like, okay, now, of course, now. So my question to the patient, and what I want the patients to understand is, where is the evidence to support that? You're saying that no one out there will accept you. How do you know that? Did you go and ask the millions of people out there if they're going to accept you or not? No, you're making an assumption. And might be some people that will not accept you, but there might be some other people who will accept you, right? When you make such a statement as a fact, and you're saying there is no one out there, of course it's going to affect you and make you feel depressed, right? So I work with the patients to examine their thoughts, examine their beliefs, find evidence to support it, but also find evidence that doesn't support their thought, and reframe it into something that is more realistic. Sure, some people will not accept me out there with my skin condition, but some people might accept me. When you say that to yourself, the intensity of the feeling, the intensity of the depression will lessen. So change the way you feel, by changing the way you think. That's pretty much what I do.
Now, this might be, I'm not sure, but is this sort of the idea of what cognitive behavioral therapy is? Because, we hear those terms a lot, and I think a lot of people don't really understand what those mean and what services are actually available, where it's directed talking, and there's a goal there. And is that kind of along those lines, or am I totally off there?
You're absolutely right. This is exactly what cognitive behavioral therapy is about. Cognitive behavioral therapy, it was created to help a patient examine the beliefs and the thoughts that come to a person's mind, and how these beliefs and the thoughts affects a person's feelings,
Mm-hmm.
behaviors,
Mm-hmm.
and physiological reactions.
Mm-hmm.
And
Oh,
all of them are connected with each other.
right. Yeah.
So someone who might have, so physiological reactions can now affect a person's thoughts and feelings, right?
Yeah.
So someone who starts having vitiligo or
Mm-hmm.
HS, they
Mm-hmm.
might not have never had depression in their past,
Mm.
but now the physiology or the skin condition, it starts to bring on symptoms of mental health issues,
Yes.
right?
Mm-hmm. Yeah, and I think it's important to sort of mention too that, even if you haven't had a history of mental health or anxiety or depression, that, your physiology is now kind of putting you in a new state. And it's important to kind of address that and realize that, hey, things aren't the same, or I need to have a different framework or a mindset to how my body is changing as we get older, especially with HS and with vitiligo, that, it's something that stays with you, once it comes, it doesn't go away really. So I think that's really important to also kind of mention that there's an evolution. There's times where you may go forward and you're doing really, really great, and there's times when you get a little bit more depressed or you're a little bit more sad, but you have those skills to correct or to catch that self-talk basically to yourself, with devoting that time to seeing a mental health professional. And I think that sometimes that part gets missed a little bit, is that you're getting a toolbox basically to help with your everyday, and not necessarily these golden epiphanies of who you were and how your childhood affected you, but you become better at knowing yourself. So I think that's a really, hopefully, really encourages people to consider talking to someone whenever they feel like they need. And is that, is there ways, especially in the world we live right now, in regards to isolation and just a stressful time with the pandemic, where we can maybe do something more daily to kind of foster that within ourselves and help, especially since not everyone has access easily right now to care?
Sure. There's a lot of workbooks out there that are self-help workbooks, and we are extremely lucky to actually have YouTube. Now, there's a lot of professionals out on YouTube, and if you search it, like cognitive behavioral therapy or psychological techniques, self-help, of course you have to do your homework, because not everything that is out there on the net it might be accurate, might even be suitable for you. But there is a lot of help out there that people can do in their like seat, if they're not willing to talk to a professional right now. There is a lot of books that I suggest, is mainly kind of a book called Mind Over Mood. And again, I'm not associated with these books, but I'm just saying these are the books that I use with my patients
Okay.
when they're ready to kind of work on their own between sessions. So it's kind of like a homework.
Mm-hmm.
And it introduces patients to the concept of cognitive behavioral therapy and what they can do. And so that's definitely something that the patients can do. Also, of course, there is tons of anxiety reducing techniques out there, whether it's deep breathing,
Mm-hmm.
um,
Yeah,
you know,
I like that one.
right?
Yeah.
Imagery techniques where the
Oh.
person's can pretty much kind of like you close your eye and
Mm-hmm.
then you're just sitting and you're deep breathing, but at the same time, what you're doing is you're imagining yourself in a place that is really, really peaceful. Sometimes people can imagine themselves inside maybe a place of worship,
Mm.
on top
Okay.
of a mountain, in front of a beach. And the person is really taking a free trip to a place that really kind of going to provide them peace
Mm.
and give them that kind of break that they might need from the stressful thoughts that they're having or the stressful situation.
Situation. Yeah. No, so there is I mean, I guess we're kind of in some ways a silver lining to all of this is that social media has really amped up its connection, you know, and as you said, you know, do your research, make sure the people you're looking at are, you know, they have some legitimate resources and backed, but we do have access to a lot that we can do independently. And then perhaps, you know, when things get better, you can bring that workbook with your counselor and say, hey, you know, these are things I've noticed over my isolation period. You know, how can we, I don't like this about myself, or I don't like the way I behave and with my kids, or I talk about this condition. So I think that, you know, if we had to look at some positives in this moment, I mean, there's definitely time to reflect a little bit now. And I also want to be really mindful of your time, but I'm going to ask you one more question because
Oh, sure.
this one is a big one.
Oh,
And it's
sure.
one that we, as HS, you know, one of the constants in addition to always working on our mental health is there's a lot of chronic pain with this condition, whether it's coming from post-op surgery, whether it's just having, you know, recurrent tunneling or abscesses and nodules. And it's, you know, sometimes unpredictable. And there is some of our community members really do enjoy and have recommended that they use meditation to sort of keep themselves in a stable position when they're feeling pain. Do you have any recommendations or anything on how to kind of mentally deal with being in pain?
Being in pain is very, very difficult. I mean, it's just, you know, your body's saying you, hey, there's something wrong here, and
Yeah,
your body is firing all of that, right? And
yeah.
all of that, your brain is getting all of these messages that there is pain. Um, I think, in psychologists and mental health professionals, uh, I want to say that there is some of us that have a specific specialty in,
Mm,
in pain management, but not all of us do, right?
okay.
So I can just give like maybe general examples of how to deal with the pain,
Okay.
but
Yeah.
I don't have any specific recommendations because this is not one of my specialties
Okay.
on how to deal with the pain.
Yeah.
But as we said, uh, I guess recognizing the pain and recognizing the impact of the pain on our own emotional well-being,
Mm-hmm.
that's really the number one kind of acceptance of what we have to do
Okay.
and what we're kind of dealing with.
Mm-hmm.
And then doing a lot of, like just as you said, meditation, um, you know, talking to a professional, in addition to, of course, getting medical,
Mm-hmm.
your issues met through a physician or even maybe like a pain specialist.
Mm-hmm.
But I really don't have a lot of
Yeah.
resources to provide besides that, the regular seeking like just professional counseling.
Mm-hmm.
Uh, yeah,
Yeah.
so
No, and it's a difficult, you know, like I think that's because obviously there's going to be, you know, a physiologic management to it, you know, but just accepting that your pain can alter your behavior, you know, when you know you're going to go into a painful a flare, maybe you can communicate with a loved one that, hey, I might be more, easily snap at you because I'm in this pain, or being okay accepting that I'm allowed to, acknowledge that this is a painful experience and that I may have a lower tolerance to certain things, or I may need to be more mindful of, what I expect from others or what others expect from me when I'm in pain and I have this chronic pain. And I think that that's definitely something that I think sometimes as a community, we're really hard on ourselves about.
Yeah, and definitely, as you said, that's a great idea and a great thing to do is communicate with loved ones and people in your life, how
Mm-hmm.
the pain affects your ability to tolerate things
Mm-hmm.
or ability to deal with certain situations, but also be
Yeah.
mindful that the other person on the other end, whether it's a child, your child, or anything, or
Mm-hmm.
someone, or your a loved one, they're also, although they might not feel the pain that you're experiencing, but when you're irritated and you're yelling or kind of like having a severe emotional reaction, they're
Mm-hmm.
also receiving that, right?
Right. Mm-hmm.
Just be also aware that um, because you are experiencing pain or you do have HS,
Mm-hmm.
that doesn't give you the okay um, to talk in a manner that is hurtful to others,
There's, mm-hmm.
right? So don't
Yeah.
use that as an excuse to, well, I have pain, so that's okay for me to talk that way. No, that's not
Yeah.
okay, right?
Yeah.
So
And those could be one of the, I think, maybe ways to kind of to consider therapy or counseling. How do I communicate this in a loving, mutual way to my family members or to my loved ones? How do I express myself while letting them also realize, to let me know what they're going through when they see me in pain and they see me upset. And I think, um, pain is a huge, like there's so many factors that go into it. Your perception of pain, what you're physically can be measured. So I think that just thinking about, what can I modify and how can I become more resilient? And sometimes that's as easy as saying, it really sucks to be in pain and I need to talk to someone about it who's not my partner all the time, or who's not my sister or whatever, and that's another way that it can be useful maybe. So I think
absolutely,
that's
yeah,
important.
absolutely. And the counselor and the therapist will help the patient explain to their loved ones how to communicate the pain. A
Mm-hmm.
lot of times, sometimes it's really hard for us to sit with someone and just kind of have that conversation, maybe
Mm-hmm.
because we don't have the confidence or maybe the ability to do so, or maybe the other person in front of you is not able to understand what you
Mm-hmm.
really is going through.
Right. Yeah.
So there's really different ways of communicating. And
Mm-hmm.
sometimes we as therapists will actually invite the other partner in the room with us. So all of
Okay.
us, all three, would be sitting together and talking with each other.
Mm-hmm.
And the therapist at that time will be able to direct the conversation where someone is trying to communicate their views,
Mm-hmm.
and then maybe the partner is trying to interrupt them. No,
Yeah.
that's not going to happen. No, this is your time. When you are done saying what you have to say, then the other
Mm-hmm.
person can share what they believe. So everyone feels
Yeah.
that they have the time and their ability to fully communicate what they're thinking. Um,
Mm-hmm.
um, so yeah, that is definitely very important
Mm-hmm.
to share. Yeah.
Yeah. No, and I think that's I just to sort of kind of wrap things up here, it's just, I think we kind of have touched, because one of the big things that HS people sometimes get is, they're like, well, you don't look like you're sick, or you don't look like you're in pain. And even, I think maybe because it is a skin condition, they're like, well, everyone has, acne or pimples or something. So there's a lot of assumptions that you work with. And sometimes it's easy to kind of shut down, and other times, you're more aggressive about kind of getting your needs out, and realizing that some of how you experience the condition and pain can be how you're communicating, and your communication style can actually help you feel better at times. And I think that's like a big thread here, you know, that we don't have a cure, we don't have the best treatment options available, but we can definitely work on the way we talk to ourselves about the condition and what we're going through. So I think that hopefully that has helped people you know, see a different aspect to therapy, that, you know, you don't necessarily have to go when you're at, you know, the lowest of lows. You can go when you're still doing well, but with like more tools.
Absolutely, more tools, just a little bit of assistance. And therapy doesn't have to be a long term, but you and your therapist will sit together and come up with a plan on how to deal with this, how long is it going to take. And again, get the tools that will help you between the therapy sessions. And sometimes the therapist will actually have to go back and work with you on things that even part of your personality. Each one of us have a personality style. Some people are, you know, their personality works really well with, you know, I accept this condition, I'm going to deal with it the best way I can. And some people are, because of their personality, they find a lot of difficulty accepting and kind of working through the condition. So all of that stems from the person's, you know, rearing, how they were raised up, the beliefs that they have about who they are, things that kind of like we as human beings and we as children and even maybe teenagers develop our own beliefs about who am I as a person, and how should I react to other people. And that kind of extends even into early adulthood, like maybe 20s, 25, 30, you know, it always changes. But the therapist will be able to work with you through these obstacles and challenges, and get you to think about certain things from different perspectives.
And I think that, you know, we really try to emphasize in our group, especially, that this is a really personal disease, as just as much as the physical symptoms can differ between people. The way you react to each up and down is also really dependent on your upbringing and what your, you know, kind of main goals, or your, you know, if you're really resilient, or you know, maybe need a little bit more guidance and help through that, you know, and not everyone's ready for that at the same time. But I'm really glad that we were able to sit down and talk about this. I think, you know, there's a lot of, you know, a lot of people don't always talk right away about counseling and therapy, but hopefully this opens up conversation in our support groups, and now they can reach to you as well, and come to this interview and just realize that, you know, it can be a gradual, relaxed, easy approach, you know.
Absolutely.
So thank you for your time. Is there anything else you'd like to end on, or everything?
Not really. Wishing everyone the best, and hopefully the year 2021 will be better than 2020.
Let's wish everyone that.
Let's be optimistic here and hopeful. Optimism and hopeful,
Yes, I definitely agree. And again, thank you for your time, and I'm going to go ahead and end this recording, and hopefully the Zoom gods will be with me.
Okay, great.
All right, thank you.
You take care. Bye-bye.
All right, bye-bye.